Hello and Happy New Year! Today I'm going to talk about depression again, because this is my main scientific aim: to understand better depression, how we can detect it, and what really helps. And speaking of that, I will return to neurology and movement disorder, which is first area that I was active as a PhD researcher. We were basically using transcranial magnetic stimulation to see whether we can change something in increased excitability of cortex in Parkinsonism. So every neurologist knows that in Parkinsonism, for some reason, the neuron in the cortex on the surface of the brain of the patient are more excitable, more active than in people who don't have that disease. And some similarity, resemblance is present in depression too. No one knows what depression actually is, what is the cause of disease. We just know that numbers are rising, and especially due to this crisis, more and more people are seriously depressed, and healthcare systems are overwhelmed with pandemic, and the probability that someone who is really sick with mental health issues is probably not going to get that help, because the numbers are really rising. I'm mentioning here one very important publication from the last year, when the authors actually illustrated how numbers of mental health care issues risen during the first couple of months of pandemics, and they reported 48% of increase, when basically all hospitals became COVID hospitals, and it was close to impossible to find help for something else other than virus that we are trying to beat down. Speaking of Parkinsonism and resemblance of symptoms of depression, I'm not going to go in details, because I suppose most of the people who are watching this don't need necessarily to have knowledge from medicine. But the thing is that both Parkinsonism and depression, when we are looking to biochemistry, both have problems with production of dopamine. In Parkinsonism, the problem is that a deep brain structure called substantia nigra, the neurons are dying out for some reason. We still don't know why. The problem is that only when more than 65% of those neurons are already destroyed, the person develops clinical symptoms, meaning certain behaviors and movements that can be used, they are labeled with this diagnosis. And then it's already too late to do something, because when such a great portion of the structure is destroyed, the problem is that those neurons which are producing dopamine cannot be replaced. Some people who are diagnosed with Parkinsonism actually very fast become reliant on somebody else's help. They cannot live independently. In some people, living with Parkinson can be for a couple of decades without big changes, and it is really individual. And we still don't know what is going on, what is actually the biggest risk factors, and why different people have completely different history of disease. I didn't want to go in such a detail in Parkinsonism. I just wanted to draw one parallel with depression. Not only that production of dopamine is important for the disease in both cases, something which is discovered recently in 2013 is that also in depression, deep white matter tract is destroyed for some reason. We still don't know why. There are several hypotheses why this is so, but the important thing is that deep white matter tract, this is a bundle of nerves. You can describe it as a cable which are bringing signal from one area to another, and this is very important highway between prefrontal cortices and limbic system. You probably heard that limbic system is important in emotions and in many other things, by the way, but the thing is that higher centers in the brain, like those in prefrontal cortices, have the power to suppress amygdala and limbic system, meaning that we have some control over it. And when somebody has depression, they have problem with controlling the affect. Controlling the affect means controlling your feelings, controlling your how you react when you feel a certain way. And it is important to realize that people who are suffering from depression especially have a problem in disengaging from negative emotion content. For example, if a person who is healthy, I mean healthy in the sense that she doesn't have depression, encounter some unpleasant behavior of someone else or have negative experience, she will probably very soon get on and do something else. And person who is affected by depression will struggle with that for a couple of hours, maybe for a couple of days, thinking what I did wrong, why this happens, why this something happens to me, blah 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 blah, and they are a kind in a rut and they simply cannot stop it. In 2013, de Kwastenit and his colleagues actually discovered in one fMRI and digital tractography study that those white matter tracts which are connecting prefrontal cortexes with limbic system are damaged. They are not fully functional, meaning that they find out that one part, the second part of unsynaptic fasciculus, this is officially the name of that deep white matter tract, bundle of nerves, of nerve fibers, is for some reason damaged, meaning that signaling between those very important parts, prefrontal cortices and limbic system, are not functional enough. It is just like you want to send a message and only 65% of the cables are actually bringing that information to the target. In healthy person, all 100% will do that job. In depressed person, only 65% of that information are coming to the target, meaning that they want to control that feeling or affect, but they cannot. Something is wrong. They would like to execute their function, but they cannot. So what they do, like in Parkinsonism, if you have a problem with control of movement, you find some other way, some other circuitry in your brain to perform the same task. We call that compensation, like finding the other way how you're performing the task. That means that you employ completely different connections in your brain that are still healthy, do something else which normally people don't think about, because this is on completely automatic level how we perform our movement. But my opinion is that probably due to that very deep anatomical damage, probably to very high levels of cortisol because of the stress or something else, we still don't know. I'm not going to go in this direction. Probably as a consequence of that, the circuitry used for controlling of the affect is different, and probably as that difference, you can see on the surface of the cortex that something is different in comparison to healthy people. And remember I said in Parkinsonism, neurologists noticed a long time ago that the surface of the cortex of the brains of people who develop Parkinsonism are more excitable, more active than in healthy people. So similar things can be noticed in people with depression. So this is the basic fact for detection. Why detection is important? Even when you say depression, different people consider different thing labeled with that word. For example, many people are using that colloquially, I'm depressed, just because something they wanted didn't happen that day, or they're unsatisfied with the outcome of something, but this is not depression. You maybe are in a bad mood, but you're not depressed. For that, you can resolve that in many ways. By the way, you can talk to a friend or family member, your sister, brother, mother, your neighbor, or someone like that. You don't need a psychiatrist to do that. Many people completely are misinterpreting this. They think that that feeling is depression. This is not. This is very far away from serious depression, serious illness like depression is. what is going on in depression is that they have to find a way to cope with their inability of controlling the feelings. I read a long time ago that an adult person can change only one thing, and this is yourself. You cannot change other people. So in depression too, people who have problems with depression, despite that we don't know the cause, we don't know, is it a physiological cause, it is some predisposition, it is not genetics, we know that, but maybe you're just fragile in that matter. Maybe your structure or personality is also prerequisite to you to become ill on depression, and you're 1 in 4 persons alive who are having that problem during their lifetime. So what can be done? First of all, you need to understand your illness. Of course, you cannot do that when you're in episode, but when you're better, you should try to understand the mechanisms how other people feel. And first of all, just to label it and to see that you're not alone, that it's not just you that is having that problem. Second, a part of medication and treatment, there are several things that help. It can help if you simply move, if you let yourself be somewhere outside, walk in the woods, be in the sun. I'm not saying that you should forget about medication and any other treatment available and go walk, but those are simple things that you can do without anybody else's help. Of course, it can be that some people who are suffering from depression cannot move at all, and they might wish to do something, but they don't have energy to move. I'm not talking about this. Of course, medication are saving lives, because depression is the only disease when people completely lost the zest of life, then they commit suicide. They are in pretty high risk of suicide, and it is irresponsible to tell them that they should walk, they should exercise. But I'm talking generally to people, because it is so frequent, it is everywhere around us. Maybe you yourself even had depressive episode, didn't even addressing that at all. Because when depression comes, very often it returns during the next crisis in your life. So even if you don't have exact explanation, there are several therapies that can help, and you should try to understand that and reach out for help, because other people can help you. And I know also that in depression people tend to isolate themselves, which is natural but completely wrong, because when we cannot stand some situation or some pressure anymore, it is completely natural that we withdraw from other people. But again, we are withdrawing also from help which is reachable. Let's talk about depression. I'm going to inform you about different aspects of it every week.